Hi, I'm Dr. Paul, and I wanted to go over with you today about constipation because this is something that's not talked about comfortably, and I talk about this with my patients all the time because when you're stopped up, it does not feel good. You feel sometimes miserable. So I wanted to show you some tips and tricks that have worked very successfully at getting rid of chronic constipation. And obviously, it's a multifaceted thing, but here's some general broad guidelines that I want to go through. Today, I just want to talk about movement. Basic things that I find our society is not doing as much because why? 100 years ago, we were farming. Now we're just sitting and we're less active. And so activity is a critical thing for our bodies. If we don't move, we lose it, right? How do you move? Well, I recommend, as you see the information on my blog, just walking in the sun, getting vitamin D. That's a critical thing that almost every patient that walks into my office that I check their blood work, they're low and sometimes severely low vitamin D. And so that's an easy fix. Just take vitamin D, make sure that you get an absorbable form. I use only quality brands, and the only way you know it works is if it raises your blood levels of vitamin D. So here's a specific exercise you can do. If you find that you're just you're not getting a sensation like you need to go, and you know that you're going regularly at a certain time of the day, but for some reason you're stuck today, try this out. It's moving your neck and moving your abdomen, okay, and moving your legs. So the way you do it is you move your neck, and you can do this all at the same time or separately. Try doing it separately, and then as you get used to doing it, then you can try doing it in conjunction with each other. Okay, we'll start with just movement. So let's start moving with the neck. You're going to go side to side like this. Now, why is this important? Well, all the nerves come from the brain, and the brain goes down to the colon. And if your nerves are not getting to your colon because your neck is stopping it, you got to move your neck around. So you want to feel a stretch when you're doing this. So after you do that part, you want to feel a good stretch in your neck. You want to lower your shoulder on the opposite side of where your neck is going. So if you go to the left here, your shoulder roll or neck roll to the left, drop that right shoulder down. You'll feel a stretch. Okay? Do the other side and stretch and lower that left shoulder. And you want to go each side like this, back and forth. And if it's coming from the neck, guess what? Your colon will loosen. You'll feel an urge to go. Next step is going down to the back. Now, you can go while you're breathing, arch and slouch, arch and slouch. Okay? Next thing you want to do is the low back. So this is an interesting exercise. What you do is you suck in your gut. So touch your belly button, and you go in like that by breathing in, and you go back and forth, and you can go fast by bringing it in and out like that. If you have minimal control of that, you need to work on that because your brain is not sending that signal down to the belly button for that muscle to work. Very common muscle not to work because of sitting. Sitting causes a lot of problems because we're sitting in a continual way the whole day, which shortens these muscles in front, weakens these muscles in the back, weakens and shortens the muscles of the hamstrings, and weakens the quads. And so, you've got to be able to